Dave Guilmette and I've been in the industry, healthcare and employee benefits for over 40 years. I've had the opportunity to lead some global companies, both at Aon and Cigna and Willis Towers Watson. And I've always been focused on the large employer, self-funded employers in the United States and those who have global workforces where they're looking for innovative solutions to help their employee and family covered population get the best healthcare that they can get. The best way I can describe world-class health is we're building a global marketplace built on the highest quality facilities and surgeons in the world, focused on some key procedures, ones that are really important that you have care with the best surgeons in the best facilities to get the best outcome. So we're building a network of these facilities. We'll have 20 of those up and running by the end of this year across about as many countries. And we're going to provide the administrative and the clinical support for an individual to be able to get from their home country to the destination and back to their home country safely. We'll have the information that the individual will need to understand what are the quality indicators and why am I going to this facility and why am I going to have the procedure done by this surgeon. And as importantly, a full, transparent bundle cost so that everybody understands what that cost will look like, which, by the way, when you look at some of the destinations that we have in our network and you contrast that to perhaps some places that you might go in the United States, the financial opportunity for the employer, the plan sponsor, and the individual is significant, such that we're able to provide this service to the individual at no out-of-pocket cost for the member, with a companion accompanying the member to the destination for the procedure, accommodation at that destination, including physical rehabilitation if it happens to be an orthopedic procedure that they're undertaking, and returning back home safely. No cost to the individual and significant savings, 50, 60% to the plan sponsor. I would start with large global organizations with significant workforces around the world, the United States, Europe, Asia, South America, etc. There may be a situation where an individual needs a particular type of procedure and there is not a center of excellence in their country. There's a gap that exists there, and the individual is either going to have care at a facility that is not the best that they could be accessing, or they may defer getting that care. And where we come in is we can help to provide them with the assistance, one, to find the best center of excellence, and it could be in a neighboring country or in the region, and to be able to facilitate getting them there. So large global organizations with large global workforces would be one area of focus. There are a number of clients that we serve today that are based in the Southeastern United States that are manufacturing oriented. They have lower wage workforces. And in these situations, these individuals being covered under high deductible plans that have $6,000, $7,000 out-of-pocket maximums cannot afford to have the care that they need because they don't have that kind of savings to be able to put up against those out-of-pocket maximums. So they're either going to undertake significant medical debt, or more than likely they're going to defer getting treatment. And these companies have made this benefit available to those individuals. They've taken advantage of it. They've gone near shore to the Cayman Islands or to Costa Rica, for example, for orthopedic surgeries. They come back. Their experience is outstanding. The outcome is outstanding. And they're able to do that at no out-of-pocket cost. And the employer saves a significant amount because of the cost differences between those two locations. So that would be another one. Another example that we're hearing coming up in conversations we're having with, again, global employers there are, in many cases, in the tech industry in particular, but elsewhere, where there's a generation of workers who are H-1B visa holders or others who are working in the United States who would think of their home country as being someplace other than the U.S. So large Indian populations or Korean populations or others from the Asia region, and they have expressed an interest to want to go home for significant care and treatment. So if somebody's diagnosed with a cancer, for example, they know they're going to be out of work for a period of time. They know they need a very serious procedure and time to convalesce afterwards. They'd like to do that with their family, their extended family. And that may be in one of these countries that I've mentioned. And the way the benefit programs work today is those are not options for those individuals. If they're employed in the U.S., the care is done in the U.S. And if they don't have the extended family here, they feel a bit out of sorts. And so we have the ability to be able to find them those centers of excellence in those countries, facilitate the medical travel, have them set so that they get the right kind of care and they're able to recuperate with their families and their loved ones, and they come back to the U.S. So those would be three different examples of the kinds of workers that we think this benefit is going to be really valuable for and their employers. We're starting off by focusing on a targeted set of procedures, ones that have typically very low complication rates so that the individuals who are going to be traveling to these destinations can do so safely and come back safely. So targeted orthopedic procedures, joint replacements, hips, knees, other types of surgical procedures that are of a musculoskeletal nature, back surgery, etc. Targeted cardiac surgeries as well, and targeted cancer surgeries. So that would be the suite of procedures that we're going to begin focusing on. The facilities that we're focused on, all of them, and this is a threshold criteria, all of them will be JCI accredited. So we know that the institution that the surgeon's working in is of a high quality to start. Beyond that, we're looking at the individual surgeons and we're looking at information that the facilities are sharing with us relative to the number of procedures that the surgeon's performing, the outcomes, right? Are there complication rates? What's happening as far as the, readmissions and things of that nature? And we're looking for surgeons, in particular, if you look at these types of surgeries, the number of surgeries that are performed is a key indicator. Now, not always a lot of surgery equals great outcomes, but that's a strong correlation. So we're looking for orthopedic surgeons who specialize not just in orthopedic surgery, but in the types of surgeries. So if you need your hip replaced, you want to go to an orthopedic surgeon that's done hundreds of these surgeries a year, thousands of them, through their career. Somebody who truly specializes in that particular joint. Same thing would be true of knees or hands or backs. So we're looking at that level of quality information at the surgeon level, coupled with the JCI accreditation and other key indicators for quality at the facility level. So you may be thinking that this is not a new concept, right? Centers of excellence have been around in the United States for over a decade, and the quote unquote medical tourism has been around for decades. And so neither of those have really taken off historically. So why now? And there are a number of factors that we think are really converging to make this an important issue today. One, the centers of excellence, proven outcomes. If you have certain procedures done at these quality institutions with the best surgeons, you're going to get the best outcome. No doubt about that, right? And we can do that for financial terms that are significantly more advantageous. So we make it affordable for the individual such that you're waiving their coinsurance and their copays, their out-of-pocket costs, and it saves the employer a significant amount of money. So the access challenge, the affordability challenge that people are facing today is off the charts. There isn't a day that goes by that we're not reading about somebody deferring health care for themselves or a loved one because they can't afford it. And they're insured by an employer's plan in the United States. And outside of the U.S., we have access issues that are quite significant. If I work in the U.K., I'm covered by the NHS, but if I need a joint replacement, I may be waiting as much as 18 months in pain, right? Missing work, etc. And so being able to facilitate ready access to the best facilities in the world at significant cost savings for both the individual and the employer makes the time right now. And one other factor, we have a workforce dynamic that's really changing around us. The quote unquote Gen Zers, this next generation of individuals who see the world differently, who are already more global citizens than perhaps some of us were at that point in our careers, they are becoming the majority of the workforce. And when we talk to these individuals and we talk about these opportunities, they don't think twice about looking at the world and looking at places that they can go that we can help steer them to for quality care, whether that's in the United States, outside of their hometown, or whether it's outside of the United States or outside of the UK or wherever they may be. And that kind of traveling for medical needs is happening frequently in many parts of the world today. And it's increasingly happening in the United States. So there are a variety of factors that are coming together: affordability, access, the importance of quality, that are making this an urgent need that employers should be addressing and are addressing. The process is a very straightforward one. Think of world-class health in our offerings as an extension of your existing benefit structures. This is not a standalone benefit. This is not a benefit that is tied to an enrollment decision. This is an extension of what you're already offering to a population wherever they may be in the world, right? So it could be a supplemental private medical plan in countries like the UK or Spain or other places like that, or it could be an extension of your network for your self-funded medical plan in the US. We're bringing centers of excellence, as we've talked about before, the best facilities and the best surgeons, and we're providing a service to the individual to help them understand what that looks like, to help them be evaluated, to be sure that they're safe to travel, to get them to the destination with a companion safely, and to come back. All of that work is on our side. What happens with the employers, we've got to determine which part of your workforce do we want to roll this out to. Is this for your U.S. workforce only? You want to start in the UK? Is this something that you want to extend globally? Which types of services do you want to focus on? The full suite that we offer, or very specific ones? You'll need to make decisions around whether the global network is accessible to any individual in your workforce anywhere in the world, or do you want to look at it more regionally? For example, you might have a significant workforce in the U.S., and you don't want them to travel more than a couple of hours from the U.S. So we would look at structuring that offering in the network to be more nearshore destinations, which we have in our network, versus, say, going to Thailand for a procedure. So it's those sorts of decisions. The process to get the details around the design worked out are a series of meetings that we would have, and then we would do most of the work on the back end to ensure that we're connecting up with your TPA to make sure that that flows very naturally, and it can be done within a 90-day time frame.